What are the modules today we need to cover? One second, just give me a minute. Okay, I think we are done with endo, but GIT, are we done? Mine? Not yet. Okay, so today we'll cover the rest of all the GIT, urinary and nervous system. Um, okay, to start with, okay, I'll go from, as you have all done nervous system now, I'll also start with the nervous system. I'll go back after that, okay? Okay, in my topics, as far as my topics, the first is about the cranial nerves, right? So cranial nerves, all the cranial nerve topics in mind, like usually the we will be focusing on mainly the clinical aspects, meaning like I'll give you some scenario and the questions will be either in MCQ or EMQ about what nerve you think might have been affected. Okay. Say I can give you some, like maybe in end of module you would have seen questions on facial nerve. uh, I hope you would have all got that right, because like unable to wrinkle his forehead, something like that, isn't it? Say something similar, like say for 3, 4, 6 cranial nerves, right? So for example, uh, just focus on mainly on the what happens when that nerve is damaged. Okay, so for I've always told you to remember two main things, right? SO4, LR6. You remember, as far as the 3, 4, 6 cranial nerves and all these things are concerned, regarding the movements of eyeball, all the eyeball muscles, you should remember those uh, three things, right? SO4, LR6. Maybe I can. This SO4 LR6, if you remember, superior oblique will be by fourth nerve and lateral rectus will be by sixth nerve. Why is it important? Because when the clinical scenario states that the patient is unable to look abduction or like a look laterally, the eyeball is move medially, something like that, like there is uh, about a squint, something if it is given like it is facing, I mean the eyeball is pulled medially, something like this, then you know that lateral rectus is affected. So you should know the muscle involved, you should know the nerves involved. All the other muscles are going to be supplied by oculomotor nerve, meaning oculomotor also supplies the eyelid. See this, with regarding this eyelid, I have seen many of you getting it wrong sometimes. Eyelid closure, like if you want to close your eyelids, like how you are sleeping or during blinking, when you want to close your eyelid, that closure will be done by facial nerve with the help of orbicularis oculi muscle. So orbicularis oculi, that is the muscle of facial expression, which is supplied by facial nerve, which helps you in closing the eyelid. What happens when the patient is like unable to open the eyelid? Or in other words, I can say with the patient has ptosis. What do you mean by ptosis?
Drooping
PTOSIS.
of eyelid.
Drooping of eyelids. Drooping means the patient is unable to open, the patient is unable to like lift the eyelids. When can that happen? When the levator palpebrae superioris muscle, which is in the eyelid, is affected. When does that normally happen? For that, if there is any cranial nerve involved, that is going to be the third nerve. So oculomotor for opening of eyelids, right? So when the patient has drooping of eyelid, it means like oculomotor is involved. Or when the patient is unable to close his eyes, like in Bell's phenomena, that's what happens, right? So when the patient tries to close his eyes, one eye, the eyelids remain open and the eyeballs will be rolling up. So that kind of a phenomena is will be in seventh nerve. Okay, so Those are the things you need to remember regarding this 3, 4, and 6. All these cranial nerves. So and always like regarding the third nerve, you should know that it also supplies sphincter pupillae, all those things, right? So all those sphincter dilator things, all these things you should know what is happening with them and about the movement. So basically about 3, 4, 6. If I talk about fifth nerve is sensory. You should remember how we examine the cranial nerves, right? Like above in the forehead, in the maxillary region, in the lower jaw region. For the 3 divisions of trigeminal nerve, you measure sensation, and mandibular nerve is the only part of trigeminal which carries the motor component, isn't it? So remember those points when you want to talk about fifth nerve. And then about seventh nerve, you all know very well regarding the facial nerve, all the signs, whatever you have done. And then eighth cranial nerve, about eighth cranial nerve, whenever something is coming up, you will always hear about any problem with hearing or something with balance. Okay, so because it is vestibulocochlear nerve, there will be some sort of these things. So there can be a tumor affecting internal acoustic meatus, something like, so that seventh and eighth nerve which pass through internal acoustic meatus can be affected as well. So that can be one possibility. And then about ninth cranial nerve, maybe ninth cranial nerve, it is stylopharyngeus is the only muscle that is going to be supplied, and maybe with some reflexes at the back, right? So not much in there. 10, 11, you know, like 10th is mainly parasympathetic. So something to do with parasympathetic, all the symptoms will be given. And then 11th is accessory. So how did you test 11th now? If you remember properly, there are only 2 tests we did, right? Like shrugging of shoulder and turning your face, right? For sternocleidomastoid and trapezius. So both are for spinal accessory nerve. So that kind of a question will be given if at all. Any question about difficulty in shrugging shoulder or turning his head, about indicating the inability of sternocleidomastoid muscle, then we will be talking about 11th cranial nerve. What about 12th cranial nerve? So it is about tongue, hypoglossal, right? So 12th cranial nerve. So when you protrude your tongue, normally I've told you, when it is about pulling and pushing, whether the normal side deviation will be there or opposite side deviation will be there. Please remember those things so that you know when, so say for example, the right hypoglossal supplies the right half of this thing, left side hypoglossal supplying left half of the tongue. What happens when you try to push your tongue out? Like when you're putting your tongue out, the affected side doesn't move out. So only the normal side tries to go out. So what happens is the deviation will be towards, because we are pushing it, right? So what happens? The deviation will be seen towards the affected side. Okay, but when it is about pulling, like say when you are trying to show your teeth, or when the soft palate, when it tries to pull up, the normal side is where the deviation will be seen. Okay, so when you are in facial nerve paralysis, the angle of the mouth will be pulled towards normal side. In ninth and 10th, those cranial nerve lesion, the soft palate, the uvula will be pulled towards the deviating towards the normal side. So these are some of the differences you should know. So in as far as cranial nerves, both the topics are concerned. Even if you go through the eyes where we tested, because most of the questions will be like the patient was done this test and this was the problem we had, something of that sort you will get. Okay, so those sort of questions you may get. And then regarding eyeball and ear, okay, as far as eyeball, like muscles I've told you, right? Remember about those sin and rad superior, I mean, so like other than usual, like because please go back to the lecture notes in the practical session also. I would have explained this simply, like for superior and inferior rectus, elevation, depression, medial and lateral rectus, adduction and abduction. Medial and lateral rectus No other action. Do not worry about except for adduction and abduction, no other action. So do not worry, nothing more about that. What about superior rectus and oblique? What about inferior rectus and oblique? Those are the things we need to remember. So in that case, it is just plain simple, like remember the terms, except elevation, depression. Superior rectus causes elevation, superior oblique causes depression. Superior means inferior rectus causes depression, inferior oblique causes elevation. Other than that, what about intorsion, extorsion, or adduction, abduction? You can remember sin and rad. Yes, so all superiors are intartars, meaning intorsion. Superior rectus, superior oblique will cause intorsion. Inferior rectus and oblique will cause extorsion. So it is like understood. So when I say sin, it means superior muscles, intorsion. Recti muscles, adduction. But so that varies. So you have to see how it works. So those are the things you need to remember. You don't need to worry too much about anything in the first half. And then in the second half, maybe structures again clinically, like maybe last time in the end of module, you might have found it difficult because I saw today about your, by the way, your results are out. Maybe later, the marks have not yet been given to the respective mentors yet. But they will be getting it soon by today. So maybe later you can check how you performed in your nervous system later with your mentors. Okay. So about this particular question, I saw like many of you struggled with that one particular question where never mind, like about the question was about glaucoma, where the pupil and the lens getting stuck together. That was kind of difficult to see how you perform. Like I was poor, but as expected, it was kind of difficult. But in your first row, the question will not be that difficult, but you should see like what condition are we talking about? Are we talking about increased intraocular pressure, or are we talking about cataract, something like that? Or are we talking about any constriction of pupil, dilation of pupil? So what muscles are involved, or what organ? Like, are we talking about retina or lens or something? Okay, so just clinically, what does cataract means? What does glaucoma means? Some whatever I've given there, like just to go through once, you should be fine. But all these questions are especially important for your MCQs and these things. Okay, for I don't think these questions will be asked in MEQs or anything. OSPI, regarding OSPI, in your end of module already, eyeball kind of you got questions from eyeball, so you can expect some questions from year or the practicals whatever we had. Please go through them. There are possibilities because brain is also asked, and maybe like a brain parts like with a model or something, you go through them. Those two are important. Okay. Then when once that is done, what else I had in my CNS? Cranial nerves, eye and ear, right? That's all, isn't it?
Yes.
I hope that's okay. Then I think that should be enough. So always you should remember, because in your exam, in your answer sheets, I found many of you getting confused between adduction and abduction. Adduction is moving towards midline. For example, for my right eye, if I am moving towards my nose, if I want to see towards my nose, that is adduction. When I want to look away from the midline, like when I want to look laterally, that is going to be abduction, because a lot of you got it wrong in that particular one OSPI or somewhere I saw this thing. Most of you got it wrong, and some of you got it wrong. So please make sure what is being asked. Okay. So other than that, once we are done, next maybe we'll go to urinary system. Okay, in urinary system, first we had questions on like what are the things we had. Maybe I just forgot what else we had in EOM. Okay, what was my topic on? First thing is development of urinary system. Is it? Uh, okay, development of urinary system. Maybe uh, the questions will be asked, but maybe only in MCQ or EMQ. But please make sure MCQs, EMQs are very important for your this thing for your passing percentage as well, because EMQ is going to contribute about 1/3 of your marks, right? EMQ paper, because it's paper out of 3 papers, that is 1 paper, so that is going to carry a lot of weightage as well. So please make sure you prepare well for EMQs as well. So in that case, in this embryology topics, most probably they will be asked in your MCQs or EMQs. What is important again in uh, development of a renal system? About the anomalies. Okay, usually either what structure gives to what structure, one thing. Second, we can give you some simple scenario, like say the patient found to have a double ureter or something like that. What was the embryological structure that was responsible for this, something like that. Or in other way, there will be a lot of congenital anomalies will be given, and we will give you there was a splitting of mesonephric duct, and what can be there will be something written like a splitting of a mesonephric duct was seen or something. Then we will ask you what kind of anomaly was present in the patient. So in the notes, whatever clinical thing has been given, you just see what is the embryological phenomena for that. Okay, like if what happens when the metanephros fails to form, or like ureteric bud doesn't induce the metanephros, something like that. Okay, so you please go through the abnormalities. Congenital anomalies are more important in the renal system. Okay, development. And normally you should know first mesonephric. What is the normal this thing, like mesonephric duct gives to what gives rise to the ureter, what gives rise to the urinary bladder, the normal part, and the adult component, what do they give rise to? What happens? What are the clinical conditions that can happen with any of these things? Like kind of 2 tables if you make, that should be more than enough. Okay. Uh, then what else we had? Uh, Other one was okay. Histology, right? In histology, it is important for you to read. See, ureter, urinary bladder, generally as they are similar to each other, most probably you will not get them in OSPI for you to identify. And moreover, I've told you in this urinary and reproductive module, especially the reproductive side is where you should be focusing more for your OSPI. Okay. Reproductive system, please focus on the OSPI. And then in this case, for urinary system, you can get questions in MEQ or this thing, depending on the type of question you get. You can get questions on the histology of urinary system, especially histology of urinary system focus on the kidney aspects. Okay. We have seen a lot about the renal corpuscle, what are the components of renal corpuscle, and then we have even for OSPI, this is the most important part. Okay, so you need to know what is a renal corpuscle, what's a glomerulus, and then you should know the difference between proximal and distal convoluted tubules. Okay, so in the renal cortex, how do you identify between the 2 areas, medullary ray and this thing? Uh, Cortical labyrinth, medullary rays, all these things. So just go through the cortex component, the major ones, what we read, and how to identify the difference. So those are the things which you should know. Those things. Then other than that, maybe those things, if it would have been asked earlier, then it might not come then in your first row or supply. Maybe if you have gotten any questions on them, then that may not be repeated. And then finally about histology, then histology in my renal system, not much would be there now. Then other than that. Sorry, I think I got disconnected just now. Can you hear me now?
Yes.
Okay, so always in histology, as I told you, maybe in MCQ, MQ, you can again still get a difference between proximal and distal convoluted tubules and those kind of things you should know. Okay, or like about collecting duct or this thing, they may give you some thing to identify what tubule are we looking at. Those kind of questions you can get. So you should know how to identify them over there. I think. That's about it from over there. Then what else was my topic? Breast. I think even in EOM you might have had some questions on the breast, but basically the lymphatic drainage is important, and which I think you might have. It was already asked, I think, right? About the lymphatic drainage and these things. So most probably, if at all any question, maybe one MCQ may come. Other than that, not much in breast now. Okay. In my topic, so in this case, normally, as I've told you, in urinary and reproductive module, one question will be from urinary or MEQs. Out of two MEQs, one will be from urinary system, and the second one will be from reproductive system, especially female reproductive system. So in that case, OSP expects something from male now then. Okay. So not much. So simple gross anatomy or those kind of topics, you go through them, then it should be fine for MEQs. This, that's all I can say in urinary and reproductive module. Anything else in this topic? Did we miss something? Development, histology, breast. I think that's all right. I think that's all from my topic. Maybe when, next we'll move on to GIT then, yeah? Can you all hear me? Yes, okay, okay. So, okay. GIT, as I told you, one like a one MEQ will be from like the intestine component, the second will be from, or the one will be from hepatobiliary, right? So in case of hepatobiliary system, as I've always told you, surface anatomy of the liver, surface anatomy of gallbladder, especially the fundus of gallbladder and all those things, those are important. And for gross anatomy of liver, you should be learning more about uh, the gross anatomy, especially for OSPE, it's okay to identify structures. But if I want to ask you, maybe I can ask you about the some slides where you can talk about all those Callox triangle for the gallbladder, or in this case, maybe the classification into the anatomical lobe, like anatomically and surgically, how do you classify them into right and left lobes? Those kind of questions you may get. And then what else? Like so it's face anatomy and these parts. And then you should know for OSPI also, like sometimes if it is asked, you need to identify all the head-shaped components, the components of porta hepatis. What are the components within the porta hepatis? What forms that in the H? What forms upper left, upper right, lower left, lower right? Okay, and this inferior vena cava, gallbladder, all these pronator teres and this ligamentum. What is that ligamentum? Mm, teres and all these other aspects which you should be uh, learning about, and then the caudate lobe, quadrate lobe. But no need to remember where does this lobe 1 to lobe 8 and all these things. No need to remember basically, but basic sense of how do this classification happen, like how do we divide them into like right and left, and moreover surgically how we divide them into different segments, how these 8 segments are formed, like basic understanding you need to know. Okay, other than that you just need to identify the parts. Okay, so those are important. And then what else we need to know? Again, maybe about this liver. Rather than that, and the anterior abdominal wall was by me, right? Isn't it?
Yes.
Okay, in anterior abdominal wall, maybe like the questions there will not be any questions in MEQ, but maybe in MCQ or EMQ you may get. Okay, so maybe based on like if we are talking about any lesser momentum or falciform ligament or any mesentery or transverse mesocolon or something like about mesentery in general, what is this like? What exactly is this mesentery or about the transverse mesocolon or something. They'll give you some clue about where between which to which is this located, and something those sort of some simple questions can be asked about the mesentery overall, this topic, and then the mesentery as well. So some simple ones can be asked from there. Other than that, mostly all our questions would have been asked earlier also. In the end of module, I think you had some questions from over there. So maybe then what else? You should know the segments, like uh, this abdomen regions, 8 regions, 9 regions of the abdomen, and then what are the lines that help you in dividing those things, isn't it? So those are the ones which are important. Other than that, what else? Not much now in this case. Okay, so what else? I had sessions with you.
Histology of liver.
Histology of liver also, again, like histology, I think basically how to differentiate between the three this thing. Okay, uh, how to differentiate between the classic and those kind of things, classic lobule, portal lobule, or these things, like that one particular thing. If you focus and if you are able to identify those things, it should be fine. Like what is forming the center, what is forming the periphery, what shape will them be, like there will be 1 or 2 slides on them, right? And just see when if a lobule is given, if you can identify or not, that is all. Okay, so that is about histology. About theory, I told you both important. Histology means liver and gallbladder, they are very important. Okay, you need to study them. Mm. surface anatomy for both, and few other topics also about them. Okay, there'll be only few slides explaining them, and then you need to know the parts in the inferior surface and posterior surface. Like if you call them together, like that head shaped, what are the parts over there? Those are the important ones. Okay, I think with this, that's all in this GIT. Anything else you want to know? Overall, those are the things. And as you know, like maybe you can collect your, I think you might have gotten your schedule, right? When to collect your admission tickets, means this admission slips, and then like the exams on 8th and 9th. Okay. Please be ready with all these things, like get everything, all the documents or whatever you need. Please be ready the day before. Sleep well before exams, okay? Just before the exam on that day, please sleep well, so that at least whatever you have learned until now, uh, only then you will be able to remember properly. If you don't sleep well, then you will be like, uh, it may seem you are doing good, but sometimes remembering things or some small things you may miss if you are not very, like if you are tired, you will be missing certain details which you would normally pick up in a question paper, okay? So all the best. Then anything else, guys? I think Dr. Vignesh also would have finished all his revision by yesterday itself, right?
Yes.
After
Doctor,
this, yeah.
do we need to know the Murphy sign?
Guys, come on, those are simple. When you are talking about one other thing, then Murphy sign is the one which you can know, huh? Like make that, like how you learn for uh, if you know about that particular point, then you press it, then they feel pain. That's all the Murphy sign is, like all the clinical this thing with related to the liver and gallbladder. If I would have given, please note them down because they are the ones clinically important, right? So if a scenario warrants that, we will ask you about that most probably. Okay.
Okay,
I'm
Doctor.
not asking you to go into details of all the relations and all those things. Don't waste too much time on that. Just focus on the topics which I've told you right now from my topic, and then it should be fine. But for all embryology and these things, not just in this modules, whatever I mentioned now, generally in embryology, you can, because we are going to ask all the theory and OSPE from other topics, right? In embryology, you are not going to get any OSPE questions, okay? So as a result, what happens is, generally they'll tend to ask at least one MCQ or EMQ from embryology topics, because they are not being covered anywhere else for your in your first pro and supply. So generally there can be some questions from most of the modules you may get. Histology, um, like sometimes it can be theory, like in MEQs they can ask you, or maybe like as I've told you, one OSPE out of all anatomy stations, one OSPE station will be histology. All others are going to be gross anatomy only. Okay. So one OSPE station will be from histology. All other OSPEs are going to be anatomy. As far as anatomy is concerned, all others are going to be gross anatomy. And mostly we will try to give you some models or pictures, very less. Okay. Mostly we'll try to give you models only. If we don't find any particular thing for model, we'll give you pictures. Okay. Hope you would have all seen the models that would have been displayed on the other day, right? 2 days. Did you guys go there for revision?
Yes.
Okay, so if you would have gone, if you would have seen, like mostly, if at all models and these things are given, mostly would have been from there. Okay, so those are the things you should focus. And then if it has been asked, as far as anatomy is concerned, the same model with the same question will not be repeated generally, whatever from exams, if it has been asked. Maybe even if it repeated, like there will be different set of questions only, okay? So that's one thing for sure. Because we do have a lot of other practicals, right? So we do have options of picking them up. So usually we don't do that. And then what else? One from this thing. So for as far as embryology is concerned, what structure gives to what, or if there are any congenital anomalies, a lot of these things you just list out and try to find out what causes them. Like if you have a general idea about these things, you should be able to answer those questions now. All embryology questions, all these things. Okay. Other than that, gross anatomy, and please focus on on the first day, all those things what I've told you. You just focus on those revision as on during revision during my briefing. I would have told you about few things, so just go through them, and then like whatever topics we've discussed, you just explore and read. Please make sure, even though endocrine and all these things seem easy, endocrine will give you 2 MEQs, 2 OSPs, okay? And equal amount of EMQs, MCQs, all these things are there compared to all other year 2 modules as well. So if you focus, like do not leave it lightly, so that like then you may end up leaving a lot of easy marks over there as well, okay? And as far as anatomy for endocrine, as I said, like only 2 things you need to focus mainly. Mainly one, means like 2 things in the sense like for entire gross anatomy, you have one this thing, entire histology, you have one. So definitely those 2 are going to be asked in your first row and supply or whatever other exams. And then 2 developments only. And even in my topic, I told you like a normal, those 2 tables or something which you need to remember. If you are done, then you are good to go there over there, okay? Then GIT, all these things are first, and all year 2 modules, and CVS is gonna have 2 MEQs, okay? So for CVS, generally even in anatomy, normally the questions will be either on the vasculature or on the gross anatomy of the heart. And especially, please go through that 2 slides, important slides we talked about heart sounds and these things, and about the radiating pain and so on, why and where, all those things we would have discussed during tutorials. It might be given. So those are the things in CVS. In respiratory, those are the ones for MEQs, all right? Then other, you do have development and vessels and mediastinum. Those kind of questions will be either in MCQs, and these things will be asked. For ROSPI, in CVS, generally we tend to ask with heart model and these things, they'll ask you whatever in heart model, all the parts you need to identify. Maybe the sub question will be on something else too, about asking them about either the artery over there in that groove, or some development, if interatrial septum or fossa ovalis or something, whatever is there, then they'll either about development question or on the gross anatomy questions over there, okay? So vasculature and external and internal features of the heart, most important. And for lungs, I would have told you, I've told you other day also, right? So that's all. Musculoskeletal, there will be one, definitely you will get some wet specimen, but we have to see how many good specimen are there. If no wet specimen, then maybe pictures will be given, okay? But usually wet specimen will be given. And as I've told you, focus more on all the cubital, femoral triangle, cubital fossa, femoral triangle, shoulder region, so cubital fossa, shoulder region for upper limb usually, and then a femoral triangle, popliteal fossa for the lower limb. These are the highly repeated topics. You need to identify the structures, and maybe one more question will be on identifying either the muscle, if at all muscle is asked, maybe either nerve supply or what action or something can be asked. And if a vessel or anything, maybe some clinical importance or where to where it extends, something like that, or give me 1 or 2 branch, something questions can be asked. Okay, if a question on extent, it means like from where to where. Okay, you have to write those kind of things. Or what's the surface anatomy? If it is very important, surface anatomy will be asked. Other than that, most probably not in that OSPI. Okay, MSSK 1 MEQ, respiratory 1 MEQ. MEQ meaning like essay questions. Okay, so respiratory there will be like around 3 OSPI stations, even MSSK 3, but CVS will have 2 OSPI stations only. Any doubts then? If not, all the best. Okay, and see you all during your exams then. Okay, guys, thank you. Okay, study well. Okay, thank you, guys.
Thank you, Doctor.
Thank you, guys.
Thank you, Doctor. Thank you, Doctor.
Later you can contact your mentors for to know about your nervous system. Okay. Okay. Thank you, guys.